While taking Christmas lights off of a palm tree, one of my children impaled themselves in the head with one of the spikes that's on the palm tree. And that's probably the most Florida thing that I've ever said. After Christmas a couple years ago, my entire family was in town, my brother, my sister-in-law, and my parents. We were all getting ready to leave on a vacation the next morning pretty early, so we were doing all of the things to get ready, putting away Christmas, doing laundry, packing all four kids, just getting everything ready. And my husband was taking the Christmas lights off of the palm trees with my kids because it's Florida and you have to put Christmas lights somewhere. And one of my kids came up and was crying and said that they just hit their head on the palm tree and they were uncomfortable. And there was a little puncture wound that you could see, but it wasn't bleeding. And, you know, being an ER doctor, I was like, you're fine. Just move on. Here's an ice pack. Keep on going. They were fine the rest of the day. And of course, it was at bedtime that they came out and like, hey, it's getting kind of sore. It hurts a little bit more. So I examined it a little bit better, took my time, and there was a little linear foreign body that I could feel underneath the skin on the scalp. Okay, so now it's like 10 o'clock and we're getting ready to leave in like 8 hours, and there's a little foreign body under there. Wonderful. As a physician, I'm able to buy medical supplies, and so I had previously purchased this like home medical preparedness kit that had like a suture kit and some needles and scalpels and stuff in it, and so we actually busted that out. I put some numbing cream on it that you can buy over the counter. It's like 4% lidocaine. I put that on it, and then I tried to get this little foreign body out. Something that can happen with puncture wounds is it goes into the skin, this hole right here, and then it goes in, but sometimes the pressure pushes it in, and then when it breaks off, it actually lodges itself a little bit further on this side of the hole. So when you reach down into the little hole here to try to pull the foreign body out, sometimes it won't come out because there's a little piece on either side. And so what you actually have to do is find where the foreign body is and extend the incision a little bit up to try to get this foreign body out. This is our little dining room table procedure area. We have someone who's providing comfort and distraction. We've got a light source that is also provided. And then we have the patient papoosed or wrapped up so that their arms stay down and not reaching up and grabbing sharps, which could injure both myself and them. Scalps tend to bleed a lot, and so I did inject a little bit of lidocaine with epinephrine to try to decrease those blood vessels, stop bleeding quite as much, and I was able to get a little bit better visualization and get this little centimeter and some change foreign body out from the scalp. Got it all irrigated, rinsed out, and then put them to bed because it was past time at that time. And then by the next morning, it was almost like completely healed, like it was sealed, like the wound was like almost gone. It's crazy how fast these things heal in kids. This is something you shouldn't attempt at home unless you're an ER doctor. And generally, I don't even doctor my own kids, but a small kitchen table procedure I thought was reasonable. Use caution when taking Christmas lights off of palm trees because sometimes they can bite back.